Hi, I'm Susan Taylor with Scripps Health in San Diego, California. You are pregnant and you have just found out that you are having more than one baby. Now what? How do you prepare for multiple pregnancies, multiple births, having twins or triplets? Joining us to talk about this is obstetrician and gynecologist Dr. Daneshmand. He's medical director of the Scripps Clinic perinatology program. Thanks for being with us, doctor.
Thank you so much for having us, Susan.
Okay, so you've just found out twins or triplets. Now what, aside from
Oh my God.
screaming?
Oh my goodness. Yeah, it's exciting time. So typically when a perinatologist or a high-risk obstetrician sees these patients, the patients have already been seen by their OBs, and so they've been very extensively counseled. For us as perinatologists, or again, high-risk obstetricians, what's important is the number of placentas, for example, these babies have. So remember, when we think about pregnancy, Susan, we think about mom, placenta, and baby. The placenta is kind of the intermediary between the two, right? Does all the functions as far as making sure the babies get oxygen through mom, get rid of all the toxins. So it's important to know how many placentas babies have. If babies have a placenta of their own and they're in the same sac, in a separate sac than the other twin, then that has the least amount of morbidity or complications. But sometimes twins share one placenta and have two separate sacs, or even sometimes they share the same sac. And those complications go up with those types of multiple gestations.
So why are multiple births riskier?
Multiple pregnancies have an increased risk for hypertension or high blood pressure in pregnancy. It increases your risk for developing diabetes in pregnancy. One of the biggest risk factors for babies is also preterm birth. These moms that are much higher risk of delivering prematurely. These moms also have a much higher risk of bleeding and requiring a cesarean section, for example. So, and also remember, there are two babies, so there's a high risk of chromosome abnormalities and also congenital abnormalities.
So what are the symptoms of these complications?
So with preeclampsia or elevation in the blood pressure, these symptoms are typically gaining a lot of weight all of a sudden. So in the last month, in the last week, for example, I gained about 7 to 10 pounds. It's non-dependent edema, such as my face or my hands getting very swollen. Feet a lot of times are normal, as we know. Patients may have a really bad headache. Patients may have visual disturbances. They may have epigastric pain or pain in the middle of the chest or to the side of it, on the right side. With preterm labor, typically these patients are experiencing contractions. So it's a rhythmic contraction that patients experience. If they're experiencing more than 6 to 8, for example, of these contractions in an hour, we ask them to go in to be evaluated. Those are
Go
some of
into
the
the ER?
go to the emergency room or go to the labor and delivery, depending on the gestational age of the babies.
And so what should the mom to be doing during pregnancy, and what should she avoid doing during pregnancy?
That's a good question. So moms should be, with multiple gestations, since they're at an increased risk of developing preeclampsia. For example, we advise taking low-dose aspirin or baby aspirin, typically anywhere between 12 to 28 weeks. The earlier, the better. This is to avoid the risk of, again, elevated blood pressures in pregnancy. We ask patients, again, to focus on inflammation, Susan, which means you got to make sure you get some sleep. Moms need to be selfish. Really, they need to be selfish. They need to be taking care of themselves. They need to be in tune with their body. So we ask them to exercise, have a very well-balanced diet, make sure your mind is calm and cool. So again, stress and also emotional well-being is extremely important. Avoid any, exercises that put you at risk for a fall, for example. Also making sure, again, you're avoiding all the common sense stuff. You're not smoking, you're not drinking, you're taking care of yourself, which is the most important.
So this is supposed to be a really joyful time. It can also be a really stressful time. What impact does stress have on pregnancy?
We don't know exactly what the deleterious effects are, but we know that stress is a silent killer of all of us. So I tell patients, please make sure you engage in any type of activity you can to reduce your stress levels.
So how do you reduce your stress level?
All of us respond differently to how do we cope with stress. Some like reading, some do meditation. Breathing exercises is something I do. Some people go for walks. So whatever it is that makes it better for you to manage stress and not react but respond, whether it's talking to your psychologist, talking to a psychiatrist, talking to friends, watching comedy, whatever it is, it's important that you do that. Also finding some silent moments for yourself, be in a quiet place where you're thinking, reflecting. It's really important for really pregnant moms, Susan. They do so much for our society to make sure that, again, selfishness is important. They got to think about themselves and take care of themselves.
So what should the mom to be eating and drinking, and what should she avoid eating and drinking?
don't eat sweets, put aside cakes, cookies, all that stuff. Eat as much as you can, as healthy as possible, very well balanced, as much as you can. Again, no hormones or antibiotics in your food. Think about types of foods that promote blood flow, like pomegranate, beet, leafy green vegetables, for example, berries, things that are very good. Obviously, again, the common sense stuff. Don't, drink any alcohol, avoid any, illicit drug use, smoking. I mean, these are common sense stuff. So typically that's what I recommend to patients. We also ask patients, again, to increase their iron supplementation and also their folate supplementation, because moms that are carrying 2 babies or more, these moms tend to be more anemic. So it's important to take your supplements.
And one of the biggest concerns of multiple pregnancies is giving birth too early, preterm labor. And the babies have not fully developed in this case. What does this put those unborn babies at risk for?
If the baby delivers, for example, at 23 weeks or 24 weeks of gestation, these babies have significant, complications. They could have blindness, they could have cerebral palsy, they could have, respiratory issues, right? The lungs haven't fully developed, right? These babies can bleed inside their heads. They can have inflammation of the intestines. So the complications are, could be very significant. It could be on the gestational age. We have a great neonatal intensive care units at all Scripps facilities. These are highly trained physicians and support staff that take care of these babies. We also have very good outcomes. So depending on the gestational age, again, there's an inverse relationship with complications of prematurity.
And the impact of giving birth to babies that weigh less than 7 pounds, what's the impact and what's the ideal birth weight?
So, I mean, typically on average, babies with twins are about 5.5 pounds. With, for example, if you had triplets, they're usually about 4 pounds, because of, again, the gestational age. Typically, multiple gestations or twins that have 2 separate placentas, they can go all the way up to 38 weeks. So these babies typically can be 6 pounds, 5.5, 6 pounds, even 7 pounds. We want those, for us, the gestational age is also very important, the age of the babies. So as long as there's no evidence of growth restriction. Remember, Susan, some of it is also constitutional, right? A lot of it is genetics. So if I've got a small mom, I'm not expecting that mom at 37 weeks, for example, to have a 7-pound, 8-pound baby. So it's important to make sure that we get to a gestational age that's safe for those babies and also have a healthy weight. But we also look at parents, right? Because again, genetics matter.
So in addition to seeing an obstetrician gynecologist, why should women who are giving birth to twins or triplets also see a perinatologist, and explain what a perinatologist is?
Well, a perinatologist first is a consultant to obstetricians, to family practitioners, to midwives. We are fetal radiologists. We look at babies all the time when moms are pregnant. We're also consultants, right, to these other providers. We are part of the team. So if an OBGYN, because our OBs are incredible, they really are. If our OBGYN wants to have a consultation with maternal fetal medicine because of, for example, having an ultrasound or a consultation regarding the complications associated with multiples, then that's what we do. But we are working side by side with our patients' OBs, and so it's a team effort.
So talk about the perinatology program at Scripps Clinic.
The perinatology program at Scripps Clinic, its inception was in August of 2018. We are a group of providers that are providing care to high-risk women across the county. We have offices in Encinitas, we have offices in La Jolla, and Scripps Mercy San Diego and Chula Vista. We partner with other subspecialists, both in adult and pediatrics, to make sure that, again, we take the best care of our moms and babies.
Any final thoughts, doctor?
I tell patients, do things that make sense: sleep, exercise, nutrition, stress, and emotions. That reduces inflammation and hopefully provides the best outcome for your child and your pregnancy.
Dr. Daneshmand, thanks so much for being with us. We appreciate it.
Thank you so much for having me.
If you want more information on how to prepare for multiple births, giving birth to twins or triplets, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks for joining us.